Welcome to the last of 5 modules of the WHO course in Environment, Climate Change and Health for practitioners and actors guiding policy change. This module provides you with essential information on priority settings for action, such as occupational and workplace health, cities or urban settlements, and healthcare facilities. These are the learning objectives of Module 5. This module explains important sources of exposure, associated health impacts, and available actions and interventions for workplaces, cities or urban settlements, and healthcare facilities. After you have completed this module, you will be able to explain sources of exposure and associated health risks in workplaces, cities or urban settlements, and healthcare facilities. Describe what type of interventions can be implemented to address these health risks, and refer to detailed resources on designing and implementing these interventions. The first topic in this module is on occupational and workplace health. This is an important topic as many people spend substantial time at their workplaces or in their occupational settings. A large number of health risks can be present depending on the work environment. Examples of exposures are listed in this slide and include high levels of noise, hazardous chemicals, risks of injuries, and long working hours. Additional health risks at the workplace arise from the lack of occupational health standards and services. Depending on the country, a large proportion of the population may work in the informal sector, often with no health and safety standards and no social protection. However, even workers who are formally employed often have insufficient access or even no access to occupational health services that provide advice on risk management in the workplace and that monitor and promote workers' health. Exposure to occupational health risks leads to a large number of workers dying each year. Similar to the long list of occupational health risks, there is a long list of adverse health outcomes that are linked to different occupational exposures. These include cardiovascular and cerebrovascular diseases such as ischemic heart disease and stroke, asthma, COPD and pneumoconiosis, injuries, cancers, hearing loss, diseases of the musculoskeletal system, and mental health conditions such as stress, anxiety and depression. Workers have the fundamental labor right to safe and healthy working conditions. This is mentioned in a resolution adopted at the International Labour Conference in June 2022. What can be done to improve health at the workplace? Implement national policies, regulations, and minimum standards for occupational safety and health for all workplaces. Implement essential occupational health interventions for the prevention of major or priority occupational and work-related diseases and injuries. Foster cooperation between the health and labour sectors to achieve healthier working populations and safe and healthy working environments. Promote healthy choices and healthy behaviours, such as those related to food or commuting to work, and health literacy and well-being at the workplace. Expand the coverage of occupational health services to all organised workers. Integrate working life aspects in the delivery of people-centred primary care. Stimulate initiatives for healthy, safe and resilient workplaces and corporate health reporting. Further guidance on actions and policies for improving health at the workplace can be found in the section on priority setting for action of the Compendium of WHO and other UN guidance on health and environment. As always, you will find the link at the bottom right corner of this slide. Please also consult the accompanying series of slides, which include additional resources on workplaces and health.